Meantime, Baltimore City is fighting another epidemic, violence among our youth.
We're joined now by Wiliam Kellibew, Director of the Baltimore City Health Department's Office of Youth Violence Prevention. Thank you so much for being here today.
Well, thank you for having me on the show today.
No problem.
So, Mr. Kellibew, why should we consider youth violence a public health crisis?
Well, youth violence is inextricably connected to poor health outcomes. When we look at experience of trauma, and I always like to say that trauma causes violence,
Definitely.
and violence causes trauma. And so as we look further down the line, there are long-lasting effects, and they're poor outcomes. So we're talking about leading to cigarette smoking, domestic violence, suicide, and many other substance use. And so when we look down the line, we have to address it. It's so important to be able to highlight and be aware. And that we prevent the violence from happening in the first place. And when it does happen, how do we mitigate the circumstances? What do we actually do about it?
So what are the long-term impacts of violence?
Yeah, could you elaborate on that?
Yeah, so there are long-lasting effects, right? So we would call them adverse childhood experiences.
Okay.
So a child who experiences trauma later in life, the effects could show up. It could very much show up in the cigarette smoking. It show up in the behavior, and so it could show up in a cycle of violence, or repetitive or repeating of the acts that happen to them. And so there are studies that show that more than 30% of individuals who experience violence and trauma may later go on to repeat the same abuse. And so we have to, again, go upstream and focus on preventing it before it happens, and bringing awareness to the issue.
So you talked about a cycle, but if you grew up in an environment where something is the norm, how do you change somebody's perception of reality to allow them to see life in a different way?
Well, you know, trauma disrupts a sense of values, your belief system. It also dehumanizes us, and also it alters our worldview. And so when that happens, how do we understand how to move forward from that, right? How do we test our reality when the reality is so steeped in what we've seen? And I take a child, for instance, growing up in an environment, and this is what this child is learning. They're repeating that, right?
And that's all they know.
Intergenerational transmission of violence, and this is quite all they know. And so how do we turn the tide, right? Well, we could expose children and expose our communities to a different value. I always say that our values and our beliefs drive our decision-making, our actions, and behavior. And so what we say and what we do is directly linked to what we value. And so how do we expose children to a different set of values? And so in school settings, and at the babysitters, we all have a responsibility. Even the lifeguard has a responsibility in terms of what kind of values will be demonstrated and exhibited in front of our kids.
So there's hope. Just because you grew up a certain way doesn't mean you have to stay that way.
Right.
Oh, absolutely.
Yeah.
Absolutely. There is hope, and we can heal from those experiences as a child. We can rebuild our lives. We can recover. And so that if anything is certain, it is that we can actually survive, and we can have hope.
Speaking of rebuilding and recovering, the health department recently received a substantial grant, $500,000, for a very important program, Hospital Interrupters. Could you elaborate on that? What is that?
Yeah, so the Department of Justice awarded the Health Department, our office on youth violence prevention, a $500,000 grant, as you mentioned, to really focus on how do we respond and meet individuals who have had violent injury where they are. And so we are expanding on our Safe Streets model, which is the longest running replica of Cure Violence model that started in Chicago. And so how do we expand and leverage what we're doing around mediation, around conflict, being able to move that into the hospital setting? And it's important that we do that immediately, because there is the risk of retaliation through gang violence, and especially gun violence. And so we're seeing an uptick in terms of youth, anecdotally, from our Safe Streets site directors, anecdotally, that there's more guns. Youth have access to more guns. And so how do we address that right in the hospital and avoid the retaliation right at the start?
That sounds like a fantastic program. Thank you so much, Mr. Kellibew, for being with us today.
Absolutely. Thank you for having me.
We appreciate the great work that you do in our community. Thank you.
And just wanted to make sure I thanked Johns Hopkins and our other partners for being a part of this. So we're looking forward to it.
Thank you. Appreciate it.
Thanks.
All right, we'll be right back, guys. Stay with us.